It really is unfortunate that this happened. You know, this is really what you call an unforced error, because the fact is, this is very likely a very good vaccine. And this kind of thing does, as you say, do nothing but really cast some doubt about the vaccines and maybe contribute to the hesitancy. It was not necessary. If you look at it, the data really are quite good, but when they put it into the press release, it wasn't completely accurate. So we have to keep essentially trying as hard as we can to get people to understand that there are safeguards in place. And I think the Data and Safety Monitoring Board picking up this discrepancy was an example of a safeguard.
Dr. Anthony Fauci a short while ago responding to the breaking news overnight regarding AstraZeneca's COVID-19 vaccine. Earlier this morning, the National Institutes of Health released a statement saying that it is concerned that the drug maker may have included outdated information in its large-scale COVID vaccine trial. That comes a day after the company announced that its vaccine is 79% effective against coronavirus. The NIH says the data provided by AstraZeneca may have provided a, quote, incomplete view of the vaccine's efficacy. This is another setback to the vaccine's already delayed approval here in the U.S. The vaccine, developed with the University of Oxford, has already been approved in Europe. European regulators have declared the shot safe to use there after a pause over concerns of possible increase in the risk of developing blood clots. Joining us now, physician and fellow at the Brookings Institution, Dr. Kavita Patel. She's a former Obama White House health policy director and an MSNBC medical contributor. Also with us, editor-at-large at New York Magazine, David Wallace-Wells, whose latest piece is entitled How the West Lost COVID. Casey Hunt is back with us as well. Dr. Patel, could you please comment on the latest news on AstraZeneca and how that could impact the world getting a hold on the coronavirus if we can't get enough vaccine delivered globally?
Yeah, Mika, good morning. And I have to be honest with you. I have never seen anything like this, and also compared notes with other public health officials. We've never seen anything like this. Simply put, the NIH was forced to put out a statement literally at midnight that Dr. Fauci must have had to wordsmith carefully, that basically said that AstraZeneca in their press release overstated their data. So that must have come after conversations with the manufacturer, surely. So this does set back, number one, public confidence. It's hard to really understand how there could be this much of a discrepancy. And Mika, directly to your point, this is overall likely a very good vaccine. It exceeds the 50% efficacy threshold. And more importantly, it's cheaper, it's easier to store, it's 2 doses, but it has been what people have thought of as a major part of the global solution. And it's just unfortunate. Another sign that despite all the success and amazing kind of accomplishments in science, that there are still kind of these, there's still these hurdles that we're going to have to overcome to get everybody vaccinated.
David, wonderful time to have you here. Your piece, fascinating piece on how the West lost COVID, comes at a time when this morning we're asking why the EU has done such a terrible job with vaccinations. All the mistakes that we made over the past year, all the criticisms rightly leveled, and I'll say from our show and from a lot of other people, at Donald Trump and his denialism. And yet here we find ourselves in 2021, and it's not the United States that right now is struggling because it didn't purchase enough vaccines. It's the EU. How bad is it there? And what does that say about not only how the EU has handled this, but how the West has?
I think it's quite bad over there. They're seeing caseloads rise on the continent. They don't have many tools to combat it. In the UK and the US, 2 places that really were catastrophically poorly handled throughout the pandemic, we've seen a much more effective vaccine rollout. And the contrast to the continent is really striking. It almost makes you think that Brexit was a good idea. But when you look at the global picture, the most striking thing about the pattern of the pandemic overall is that countries have really fallen into 3 clear groups. In East Asia and Oceania, they were essentially able to eliminate the disease within a few months so that they could have outdoor gatherings and sports. In the global south, there were relatively high caseloads, but low death figures. mostly owing to the age structure of those populations. And then across Europe and the Americas, just total catastrophic failure, where you have death rates per capita. The best European countries are more than 100 times the best Asian countries, and the average European country is several thousand times worse in terms of death rates than, say, Taiwan, which has done exceptionally well in Asia. And I think as we go forward, we're going to have to think really hard about why there was such incredible and uniform failure across all of these wealthy countries who thought themselves for a long time to be practically immune from pandemic threats, and countries that we saw as much more vulnerable demonstrated themselves and their capacity to respond much more impressively.
So, David, can you talk, let's not just talk international. Hey, thanks so much for watching our YouTube channel. You can follow up on today's top stories and breaking news, or catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.